First things first, I go ahead and introduce myself. Then I'm going to go ahead and perform hand hygiene, um, and then put on some gloves. I'm going to go ahead and do two patient identifier. And if there's anyone else in the room with her, I can go ahead and ask her if she wants them to leave. After doing so, I will go ahead and take my set of vital signs, which will involve blood pressure, heart rate, respiration rate, O2 stat, temperature, and pain. Um, Vital signs should be taken every 15 minutes for the first 2 hours after birth, and then should be taken every 4 hours for the next 8 hours, and then 8 hours after that. Then I'm going to go ahead and auscultate her lung sounds, both anteriorly and posteriorly. Any signs of crackles may indicate fluid retention. And then I'm going to go ahead and auscultate her bowel sounds. Given that I'm already in this region, I can go ahead and ask her if she has any questions about her linea nigra or her diastasis recti, if she has it. Let's say she does have questions for both. I can go ahead and explain to her that her linea nigra occurs due to an increase in melanocyte stimulating hormone and that it will go away just to avoid the sun for a couple of weeks. And their diastasis recti occurs due to separation of the abdominal muscles during pregnancy, and that it will also go away. So after doing that, I can go ahead, auscultating her bowel sounds, I can go ahead and inspect her breasts. I will inspect for any tenderness, for any venous enlargement. I'll ask her if she's seen any discharge of colostrum. And then after that, I can go ahead and assess her catheter if she has one. Let's say she does have a catheter. Then I will record the volume and the color of the urine. I will empty the bag, and then I will assess for any bladder distension. At this point, I can go ahead and explain to her that it's important to urinate frequently and to avoid a full bladder, given that a full bladder can cause uterine atony, which can increase hemorrhage, and it can shift the uterus laterally. After doing so, I can go ahead and assess her lower extremities, assess for any edema on her feet by taking off her socks, by gently pressing on the skin. And then I'll record +1, +2, +3, or +4 edema, whatever may be present. I'm also going to go ahead and assess for any signs of thrombosis by doing the Hohmann sign, which involves dorsiflexion of both feet. If she states any pain on her calf or around her knee when doing such procedure, it may be a sign of thrombosis. She's at an increased risk for thrombosis, given that due to Verkle's triad, which is venostasis, increase in clotting factors, and damage of the inner epithelia of the blood vessels. So after doing so, I can go ahead and assess the fundus. For assessing the fundus, I'm going to go ahead and place her on a supine position or on a low semi-Fowler's position. I'm going to take my dominant hand and place it on top of the fundus. And then I'm going to take my non-dominant hand and place it underneath around the symphysis pubis to prevent uterine inversion. And then I'm going to go ahead and palpate for the firmness of the fundus. We want a firm fundus. If it's soft, then we can go ahead and massage it. This will cause an increase in firmness and decrease the risk of hemorrhaging. We also want to go ahead and record the location of the fundus. So it's either at the umbilicus, or one finger's width underneath the umbilicus, or 2 fingers width underneath the umbilicus. So I'm going to go ahead and record that. Afterwards, I can go ahead and assess the lochia. So the recommended position to assess lochia is on her side, if it's not contraindicated. with her buttocks lifted upwards. That way, if there's any excessive bleeding, it can trickle down to the linens and may go undetected. So this position helps catch any of that. So I'll assess the perineum, assess the lochia. The importance of the lochia is to assess for any early indications of infection or of hemorrhaging. If we suspect an infection, then a specimen will be collected, and then the corresponding antibiotics will be given, depending if the pathogen, let's say, is gram negative or gram positive. For hemorrhage, oxytocin can be provided to increase uterine contraction, which will decrease hemorrhaging. So after assessing the perineal region and assessing the lochia, I can go ahead and see if she has any questions, assess her psychosocial status, ask her how she's feeling, how she felt about the birth, about the delivery, and then I can go ahead and ask her if I can grab her anything, any water, perhaps any food, or change her linens afterwards. And that's pretty much it.